I want you to picture something for a moment. You wake up one morning, open your bathroom cabinet, and reach for a familiar bottle, maybe for pain, acidity, or seasonal congestion. You've trusted it for years. It sits on every pharmacy shelf. Doctors prescribe it, ads promote it. But what if I told you that inside some of these bottles lies something far more dangerous than you think? Some of the most common doctor-approved medications, the ones you've probably taken this week, may quietly overwork, weaken, or destabilize your heart. Not because you did anything wrong, but because no one ever warned you. So today, I'm lifting the curtain. By the end of this video, you'll know which 5 everyday medications put hidden pressure on your heart, why the danger increases dramatically after 60, what safer alternatives exist, what questions you must ask your doctor. This is not fear-mongering. This is heart-saving truth I wish every patient knew. Let's begin. We start with the medication most people use without a second thought. Non-steroidal anti-inflammatory drugs, NSAIDs, ibuprofen, naproxen, diclofenac, and dozens more under different brand names. They ease arthritis, joint discomfort, migraines, back pain, and they do work. But here's what almost nobody hears. After 60, these drugs can behave like gasoline thrown on a smoldering heart health fire. Let me tell you about someone I'll never forget. Robert, 74, former carpenter, loved working with his hands. Every morning, knee stiffness made it nearly impossible to walk, so he reached for his anti-inflammatory tablets. One day, he walked into my clinic breathless, swollen, and fatigued. Within hours, he was in heart failure. Not because his heart suddenly gave up, but because months of daily NSAID use overloaded his circulation. Why? These drugs tell the kidneys to retain salt and water, that extra fluid increases blood pressure and workload. Older hearts, already stiffened by age, struggle under that pressure. It happens quietly. No pain, no warning. Until one day, the heart can't keep up. And here's another twist. Certain NSAIDs can erase the protective effect of baby aspirin, the very pill many seniors take for their heart. So what should you do? Don't suffer, but have a conversation with your doctor. Ask whether acetaminophen, localized gels, or intermittent dosing could be safer. If NSAIDs must be used, use the lowest dose for the shortest time, and monitor swelling, breathlessness, and rising blood pressure. Pain relief shouldn't cost you your heart. Let's move to number 4. S. The stomach protector. That may expose your heart. Medication number 4 is almost ironic. It's prescribed to protect you. Yet lingering in its shadow is a cardiac risk many doctors overlook. I'm talking about proton pump inhibitors, PPIs, omeprazole, pantoprazole, esomeprazole, and their cousins. Millions take them for reflux, often for years, sometimes for life. But these drugs were originally designed for short-term use. So what happens when your body depends on them? Let me introduce you to someone. We'll call her Grace. She was 67. Chronic reflux turned her life upside down. Her doctor prescribed a PPI. Months became years. Reflux? Gone. She assumed all was well, but fatigue crept in. Her heart rhythm seemed off. Routine labs revealed the truth. Her magnesium, the mineral that stabilizes electrical activity in your heart, had crashed dangerously low. And chronic PPI use was the reason. Without magnesium, heartbeats can become irregular, electrical conduction goes haywire. Dangerous arrhythmias may strike without warning. And that's not all. PPIs may stiffen arteries by interfering with nitric oxide production, a molecule critical for vascular flexibility, and they can interact with key cardiac drugs, making them less effective. Does this mean everyone must quit PPIs? No. But here's what you must do. Never stop suddenly. You can rebound and worsen reflux. Ask your doctor whether dose reduction, intermittent use, or lifestyle-based reflux management is possible. If long-term therapy is needed, insist on periodic magnesium monitoring. Your stomach shouldn't be protected at the cost of your heart. Let's continue. But before we do, if this information has already opened your eyes, I'm asking for something simple. Subscribe to Heart Insights. Share this video with someone over 60. You have no idea whose life that click may save. Now, medication number 3 may shock you even more. The common cold remedy that spikes blood pressure. When the nose is blocked, the solution seems simple: decongestants. You'll see the names: pseudoephedrine, phenylephrine. They clear nasal passages by tightening blood vessels. But here's the problem: they don't stop at your nose. Once swallowed, these drugs constrict arteries throughout the whole body, drive blood pressure upward, speed electrical signaling in the heart. Imagine a plumbing system with thicker pipes suddenly squeezed narrower. Pressure surges, flow struggles. The pump, your heart, strains. For a young body, this surge may barely register. But after 60, especially with high blood pressure or heart disease, it can be catastrophic. I remember a patient, Harold, 79, who took a cold tablet to sleep better. Hours later, his heart raced so violently he thought he was having a heart attack. He wasn't. His heart was reacting to a stimulant masquerading as harmless cold relief. Safer options? Saline sprays, steam inhalation, corticosteroid nasal sprays that work locally. Your heart shouldn't fight for its life so your nose can breathe. The depression medicine with hidden cardiac impact. Mental health matters deeply, and seniors deserve relief from pain and depression. But one older drug class carries cardiac baggage: tricyclic antidepressants, amitriptyline, imipramine, nortriptyline. Sometimes prescribed today not just for mood, but for nerve pain. These drugs don't just act on the brain. They affect heart rate, blood pressure regulation, electrical conduction pathways. One man I treated, Jonah, 81, was given amitriptyline for neuropathy. Weeks later, he fainted while standing. Why? The medication caused dramatic drops in his blood pressure when standing, called orthostatic hypotension. Other patients experience irregular heartbeats triggered by these drugs. To be clear, depression must be treated, but today there are safer alternatives. If someone you love is on a tricyclic, ask whether modern antidepressants or nerve pain drugs could replace it. Ensure blood pressure and heart rhythm are monitored. Mental healing shouldn't come at the expense of your heart. The supplement most people think is harmless. And now we reach number 1. The most debated and misunderstood: calcium supplementation for bone protection. For decades, the message was simple: take more calcium, save your bones. But here's the twist. Calcium from food behaves normally, absorbed slowly, used efficiently. But calcium supplements create sudden spikes in blood calcium. Your bones can only store so much at once. So excess calcium moves into soft tissues, into blood vessels, into artery walls. This is called arterial calcification, essentially hardening the pipes through which your blood must flow. The result? Stiffer arteries, higher blood pressure, greater risk of plaque formation. Does this mean no one should take calcium tablets? No. But it means supplementation should never be self-prescribed. Only follow confirmed deficiency or osteoporosis diagnosis. Be weighed against cardiovascular risk. Preferably be paired with vitamin D and medical follow-up food-based calcium sources. Dairy, leafy greens, sesame seeds, fortified foods do not seem to carry the same risk. Nature delivers calcium slowly. Pills deliver it in a flood. Your heart feels the difference. It's not about fear. It's about power. Today we walked through pain relievers, stomach acid suppressors, cold decongestants, certain antidepressants, calcium tablets, all potentially burdensome to the aging heart. But here's what I want you to carry with you. Medicine isn't the enemy. Silence is. Ignorance is. Your heart has beaten roughly 2.5 billion times by age 70. It deserves awareness. It deserves respect. And you deserve clarity. So next time you visit your doctor, bring your full medication list, including supplements, and ask, is this still the safest option for my heart? Should I be monitored for blood pressure or electrolyte changes? Are there lifestyle or alternative treatments I can attempt first? These are not confrontational questions, they are life-extending questions. Every year, I meet patients whose hearts were damaged not by illness, but by trusting medications without knowing the risks. That ends today, at least for you. If this video opened your eyes, subscribe to Heart Insights. Share this video with someone over 60. Comment below, which medication surprised you most? Your story might save a life. Until next time, take care of your heart. It is the only engine you cannot replace.